So today you're going to be talking really about how efficacious cannabis is when it comes to treating cancer. And I think a very important topic for a lot of people. So over to Kylie.
Right, well, thanks very much for having me. So, just a couple of disclaimers. This is not intended for medical advice for anyone. So if you do want to know about your own health concerns, I do strongly suggest that you consult an integrative medicine practitioner about this. So, just my declarations. I'm the Chief Scientific Officer at Releaf Group, which is a group of cannabis clinics and pharmacies around Australia. I also am the Academic Director of an online healthcare education platform for medical practitioners and allied health practitioners to learn about the scientific base of cannabis. So this is just going to be a bit of an overview of what I'll go through today. So just some facts and figures. I'm just going to move this out of the way so we can actually see my slides here. So if we look at surveys, this one is in the US, the top reasons that seem to come up for the use of cannabis in cancer patients is to relieve certain symptoms like pain, sleep problems, anxiety, stress, and nausea and vomiting. Now this survey here is interesting because of those taking cannabis, nearly 80% did so during treatment. This was a study in British Columbia, and again we can see the most common signs and symptoms here, targeting pain, insomnia, nausea, and anxiety. Now I look at, the treatment of cancer, but also other diseases, as being part of an integrative medicine approach, which takes the best of orthodox treatment, as well as evidence-based nutritional medicine, lifestyle approaches, complementary medicine approaches. I think that medicinal cannabis does have a role to play in the integrative management of cancer, in particular the signs and symptoms that are associated with it, as well as its orthodox treatment. You can see on the left-hand side of that diagram there that I've just listed some of the signs and symptoms that can be associated with cancer, but also associated with its treatment. So we'll come back to this idea of integrative medicine approach at the end here. Now, just a few facts and figures. The prevalence of anxiety in people with cancer can be up to almost 20%. Depression, depending on the study, is anywhere between 25 and 67%. And the prevalence can increase with the severity of cancer and the symptoms. And it can also predict cancer progression and mortality, and has been found to be a psychological predictor of decreased survival time. Now, a lot of people with cancer have problems with sleep. And the problem here is that insomnia can actually continue long after the treatment. So one study found, or two studies found, that insomnia in 23 to 44% of patients 2 to 5 years after their treatment. And of course, it's important to address sleep problems in any disease because insomnia and sleep disturbances can lead to mood problems, fatigue, depression even, and this can contribute to immune suppression and affect quality of life, as well as impacting potentially on the course of disease as well. Now, a meta-analysis is when you combine the results of lots of randomised controlled trials into one study. And this meta-analysis here with 117 studies, so over 63,000 patient data, were basically pulled together. And it found pain prevalence rates of almost 40% after curative treatment, 55% during treatment, and it was higher again in people with advanced or metastatic or terminal disease. Chemo-induced peripheral neuropathy, they did a meta-analysis there, combining the studies of 31 studies, and they found that the prevalence in the first month after chemo was 68%. 3 months, it was 60%, and greater than 6 months after the chemo, it was still 30%, so still quite relevant there. Now, oral mucositis is another common side effect of radiotherapy of the head and neck, and also of chemotherapy. And it gives you ulcers in the mouth, and basically then people have trouble eating, they lose weight, so they have malnutrition, they get susceptibility to infections, and of course awful quality of life. And then finally, cachexia is the severe muscle and fat loss and marked weight loss that often causes causes death in the end. So before we start to have a look at how medicinal cannabis might be useful, we have to start to, I guess, understand a little bit about what happens in the body with cancer. And we think it's driven by genetic as well as epigenetic changes that allow the cells to actually over-proliferate. So you get uncontrolled cell growth, and to escape our normal homeostatic mechanisms would normally suppress the inappropriate growth and inhibit the survival of these aberrantly proliferating cells as well as their migration around the body. So you've got to remember, we have a perfect healing system within our cells. All our body wants to do is bring us back into balance. And so with any sort of therapies, we need to learn to sort of try to tap into that innate part of ourselves. Now, cancer is what's called heterogeneous. So each subtype of cancer is going to have different molecular characteristics. So in other words, it's not one size fits all. It can be the way that the molecular characteristics can be very different tumours and different types of cancer. Now, there's a thing called the hallmarks of cancer. Basically, these are characteristics of cancer. One is that there's resistance to normal cell death. So we normally recycle our cells and they run through a normal cell cycle of life and then cell death. And part of that is called apoptosis, so programmed cell death. But in cancer, you get a resistance to that. There's increased cell proliferation. The cancer cells evade normal growth suppressors. They avoid immune destruction because normally our immune system is going to want to get rid of those cells. There are metabolic changes, instability in genes, and the induction of what's called angiogenesis. So angiogenesis is the formation of new blood vessels and increased migratory capacity. So we'll have a look at that now. So uncontrolled cell growth occurs, and I guess on the left-hand side of the top diagram there, we've got what happens under the normal conditions. On the right-hand side, we've got what's happening in cancer. Now, as a tumour expands, the core of it loses access to oxygen and nutrients that needs that to be able to grow bigger. So what the tumour does is it secretes certain chemicals, and that then stimulates the growth of these new blood vessels, angiogenesis. And this restores the access to the nutrients and oxygen, and that lets the tumour get bigger. Now, there are changes in the cells of the tumour, and then they start to invade. So they can invade locally, and then they can go into blood vessels, and then they can get into the bloodstream or the lymphatic system, and then they start to migrate to distant sites of the body where they then produce, I guess, micrometastases and secondary tumours. And these steps, and this is what we call metastases. So that's where you get these secondary tumours in different parts of the body. So these steps, there's many coordinating molecular pathways that get coordinated between the cancer cells and their interactions with their environment around them. And they call that the tumour microenvironment. So basically, tumours are able to secrete these special chemicals, and that helps the tumour to evade the immune system. It blunts the normal immune response, which would try and get rid of cancer, and it promotes the growth and invasion and metastases of the tumour. So we've got lots of signalling pathways involved within the body, and we get dysregulation of those. So, for example, cancer-causing genetic mutations can cause affected genes to either be overexpressed or produce mutated proteins, and their activity gets dysregulated. So a couple of them are that we have normal cell death signalling, and that just basically, it's a homeostatic mechanism to control cell growth or numbers, and that gets disabled. This picture on the right-hand side is one of the pathways. This one gets revved up, so it's hyperactive, and this hyperactivation leads to excessive cell proliferation, which is a feature of lots of cancers. We also can find that there's changes in genes, and they inactivate the pathways that normally would suppress the growth of tumours. So this tumour suppressor protein that I've got up here as an example, normally that would prevent cancer formation. But when there's mutations in the gene that codes for it, then you get dysregulation in that, and then the cells can then proliferate unchecked again. So I won't go through this slide because I don't think most doctors would sort of understand this one either, but just to show there's an awful lot of pathways involved that can become dysregulated. So let's start to look at how medicinal cannabis might work, and to do that we have to understand that we've actually got a ready-made system in our body, and it's called the endocannabinoid system. But a lot of doctors don't know anything about it because it was discovered in 1990, but it's been rather slow to get into medical curriculum. But it's basically probably the most important nerve regulating system in the body, and it's responsible for homeostasis of nearly everything that I can think of. So it modulates our pain and inflammation and our immune response, our stress response and our emotions, our thinking, our memory, our sleep, the way that we process food and our appetite, the cycle of cell life and death, and even the development of an embryo right through to a baby and right through childhood. So it regulates pretty much everything. And it was, as I said, discovered in the 1990s. There are three main components, and the reason they discovered it is that they actually isolated the chemical construction of THC, tetrahydrocannabinol, which is one of the main phytocannabinoids, plant cannabinoids in the plant. That was isolated back in 1964 by Raphael Mechoulam and one of his colleagues in Israel. And they went looking for the receptors of this THC, and they actually found that, hey, we actually have not only receptors, and we call those cannabinoid receptors, cannabinoid 1 and cannabinoid 2 receptors, but we actually make our own within the body cannabinoids ourselves. And we've got enzymes that actually help produce these endocannabinoids on demand when our body needs them, and then breaks them back down when we're finished with them. So cannabinoid 1 receptors, they're abundant in our brains and our central nervous system. CB2 receptors are abundant in the immune system, but both of them are found in other parts of the body as well. So the main ones you'll hear are anandamide and one we call 2-arachidonyl glycerol. Now, ananda just means bliss in Hindi, so anandamide. And normally in the nervous system, basically the binding of these endocannabinoids to these cannabinoid receptors actually reduces the transmission of other neurotransmitters. But of course they work in cells too, so the binding of these endocannabinoids to cannabinoid receptors on the immune cells helps modulate the immune system and inflammation, for example. So this diagram just sort of shows you how widely distributed they are in the body. So essentially, we've got a ready-made system for many of the constituents of cannabis. Now, we do know from research that when you apply endocannabinoids from outside the body, so exogenous application, it actually reduces the proliferation, migration and invasion of tumours, so that's a good thing. If we inhibit the enzymes that would normally break down our endocannabinoids, that also shows anti-cancer activity. So, for example, in breast cancer cells, they found that our endocannabinoids was able to inhibit that cell proliferation and basically induce the programmed cell death that we want and arrest the cell cycle. So, in other words, stop them from excessively proliferating. Now, there are many anti-cancer pathways mediated by our cannabinoid receptors. So when I'm talking about cannabinoids now, I'm talking about the ones we make in our body, endocannabinoids, the ones that are from the plant, phyto, or plant cannabinoids, as well as the man-made ones, synthetic cannabinoids. And they can modulate the activities of lots of enzymes and nuclear factors that are involved in the development of cancer. So they can promote the cell cycle arrest and block the proliferation of cancer cells. They can induce cancer cell death, they can reduce the migration and invasion of cancer cells, as well as stop the formation of those new blood vessels. But we also find that there is dysfunction on the endocannabinoid system that occurs in cancer. So the endocannabinoid system can actually either exert a protective role, or it can actually be part of what the disease progression. So the role of the endocannabinoid system in each cancer system is quite specific to that type of cancer. And this is why in research we actually find this conflicting results. So Some have found that in glioma, for example, and that's a brain tumour, that anandamide is either increased or decreased, and the other endocannabinoid is increased. In colon cancer, they've found that both of them are increased. But as I said, it just depends on what cancer you're talking about. We also find that those cannabinoid receptors are either too much or too little, overexpressed or underexpressed, again, depending on the type of cancer. So in some diseases they've found that elevated cannabinoid receptors are correlated with higher malignancy and a greater probability of metastases, so that's spreading around the body. So now that we understand a little bit about what's going on at a cellular level in cancer, let's have a look at some of the research evidence about the anti-cancer actions of some of the constituents. Now, you've got to realise that medicinal cannabis is not one thing. There are many cultivated varieties, hundreds of them, of cannabis, and each have got their own chemical profile. The amount of THC, tetrahydrocannabinol, the amount of CBD, but other phytocannabinoids are there as well, and terpenes. So terpenes are the essential oils that give the plant its characteristic smell, and many of those have anti-cancer actions too. So I'm going to talk about the main ones that you hear a lot about: cannabidiol, which is not addictive and it doesn't get you high. THC is the one, of course, that you probably know quite a bit about. That is the one that's potentially euphoric, and I say potentially because it's dose dependent. So a small amount and you're not going to get high on it. So we want to break down some of the myths that THC is just about getting high, etc., etc. It's got a lot of valuable therapeutic properties, and dosed correctly, it's not going to give you that high that we tend to associate with, having a joint, that sort of thing. Now, they do work differently in the body. THC works like anandamide, our endocannabinoid. It binds with the cannabinoid receptors, CB1 and CB2 receptors, in various parts of our body. When it binds in the brain, of course, that can produce that psychoactive effect. Whereas cannabidiol or CBD doesn't bind so well with the cannabinoid receptors. It still does, but not as strongly as THC. But when it binds at the CB2 receptors, it helps modulate the immune system and anti-inflammatory effects that we get with CBD. So if we look at some of the anti-cancer actions, we find in the research that there is what we call preclinical, which is research done in a petri dish, cell line research, and animal research. So that's what I mean when I say preclinical, before it goes into studies in humans. And so we find that they are able to induce this cell cycle arrest, so stop these aberrant cells proliferating, induce the programmed cell death, inhibit the migration around the body, inhibit those new blood vessels forming that we don't want, and inhibiting the invasion and spread around the body, metastases, and reduce inflammation, because cancer is an inflammatory condition. But they've also found that with normal cells, these are relatively unaffected or even favoured under certain conditions. So here's just a couple of things about CBD in cells. They've found that CBD, either on its own or with other agents, can induce cancer cell death and inhibit the migration and invasion. In animal models, they've found in lots of different types of cancers, it can decrease the tumour size and this angiogenesis and the growth and weight of the tumours. It can reduce invasiveness and that spread around the body, metastases, inducing tumour regression and increasing survival of the animals. In THC, here's just some of the research. So they looked at glioma cells, and it's a brain cancer, and they found that THC was able to inhibit the cell viability and cause cell death, as well as decreasing tumour growth. In animal models, in a mouse model of melanoma, for example, THC was able to decrease the growth of the melanoma, as well as its proliferation, and again, that angiogenesis and metastases or spread to other parts of the body. So that's just some of the research there that shows that both CBD and THC are quite good. Now, other minor phytocannabinoids have also been shown to have anti-cancer activity. So remember, we talk about THC and CBD, but there is actually about 120 different phyto or plant cannabinoids isolated from cannabis. It's not just THC and CBD. and this is something we're trying to sort of teach doctors about now, is to look more at the profile of those buds and medicines that you're prescribing, and have a look at those minor phytocannabinoids, because they've all got therapeutic actions too. So I've just listed a few there that have got anti-cancer actions too. And then there's the terpenes, the essential oils. And again, when you think about a cannabis medicine, you should be looking at the fine print to see, well, what terpenes are in there as well, because terpenes themselves are in many, many plants. So myrcene, for example, is in hops, and linalool is in lavender. So these are not unique to cannabis. However, they do have therapeutic actions in their own right. And we think that they potentially synergise or work with cannabidiol and THC to improve their actions. So beta-caryophyllene is a very good anti-inflammatory terpene, for example, and they've found that it has anti-proliferative, pro-apoptotic, so increasing that programmed cell death that we want with many different cancer cell lines, but can also synergise with chemotherapeutic drugs, so doxorubicin and other drugs. So again, these are positive things for the integrative use along with orthodox treatment. So now we get into the human studies, and this is where it's perhaps not as convincing, and there's reasons why there's not so many studies in humans, and partly it's because across the board in any type of illness or disease, there's just not as much human evidence, because it's taken researchers so long to be able to get their hands on it to actually research it within humans. The exception there is probably Israel, because they've been researching it like crazy for the last 30 years and getting some really good results. So they're probably the leaders, I think. So if we have a look at human studies overall, there's not a lot of what they call randomised control studies, and that's supposed to be the gold standard of evidence in medicine. So a randomised control study is like you have one group here and they get the treatment, and the other one will get a control, and that could be a placebo, it could be another drug. And you get randomised. You don't know which group you're going into. And the doctors are doing the measuring, they don't know either, so this is why they call it a double-blind randomised control study. And that's what medicine hangs its hat on. And yet, case studies are relegated to much lower down this hierarchy of evidence in medicine, which is a shame because, you know, Chinese medicine, and that's my background, I'm a Chinese medico, Ayurvedic medicine and many other forms of medicine actually built up on years of experiential evidence. And doctors learn through case studies. So this was a review of the literature, this particular study here, 77 unique case reports on various cancers. And they said, well, look, in terms of quality of evidence, only 14% of case reports were considered strong, and they concluded no strong clinical trial data exist currently to confirm the preclinical animal and cell line studies that suggest cannabinoids might have an anti-cancer benefit. So I've just pulled out a couple of human studies here, case studies. This was 2 patients with high-grade gliomas, a brain tumour. They had chemoradiation and they had 3-drug regime, and they added CBD. And they found in both cases there was no progression of the disease for 2 years. There was some adverse effects there, but there was no damage to the lymphocytes, no damage to the platelets, and there was no liver or nerve toxicity. In this one, which is what they call a case series, so they take 9 consecutive patients, again with this grade 4 glioblastoma multiforme, and this is a quite aggressive form of brain cancer, and they all got CBD plus the standard treatment. So that was resection or surgery, followed by radiation and chemotherapy. Now, the mean survival time is usually around 15 months. They found the mean survival was prolonged to 22 months, but they did find one patient was alive almost 4 years later, and another was almost 3 years at the time that the study was published, with, in both cases, no sign of disease progression. This last one is on, again, glioma. This is Sativex, or nabiximols, and this is actually a registered drug in Australia. It's about a 1-to-1 ratio of CBD to THC. And this was in 21 patients. Now, they found in the group that had the nabiximols, the survival at 1 year was 83%, and in the placebo group, the survival at 1 year was only 44%. So that was a small study, and I guess it just brings home the point that we do need much larger studies in cancer. This is another case report of an 81-year-old fellow. He had a lung tumour. Now, he didn't want to have chemo or radiation therapy. So the picture at the top there, where you can see where that arrow's kind of pointing, that was a scan in December 2016, and you can see that that sort of mass there is the tumour. Now, a year later, down the bottom, the tumour and the other lymph nodes had regressed almost totally. And then he had another CT scan in January 2018, and there was a small little residual opacity left, and that was it. And the only thing that really changed over that time period was that he'd actually started to use CBD oil. He had a few adverse events like slight nausea and a sickening taste, but that was about it. So they're just stories of individuals, but I think these are very good because they build up a picture. Now, finally, I just want to have a look at some of the evidence around cannabis for the treatment of those symptoms and signs that are associated with cannabis and its orthodox treatment. Because remember back at the start, we just ran through all those different things. Well, anxiety. Now, there is actually scientific evidence here that CBD, for example, has anxiolytic effect in healthy people as well as people with social anxiety disorder. There are published case studies and retrospective looking back in time. There was one that was done in a psychiatric hospital where they used CBD as well as the regular medication and found that it was efficacious in treating anxiety. So we do have the gold standard, we do have randomised controlled trials that show that CBD has an anxiolytic effect. Now in sleep, so we're thinking about insomnia now, there's plenty of surveys, including one that Nick Lenceris did, that suggests that cannabis might be useful for insomnia. They did an observational study here, and they actually found, so this was 409 people with insomnia, and they used a phone app to basically rate their self-perceived insomnia severity levels, as well as sort of track any side effects that they might have got. Now, they got an average symptom severity on a 0 to 10 scale of minus 4.5. So in other words, an improvement of almost 5 points out of 10. And that is, there are randomised controlled trials, case reports and case series in the literature that show that sleep CBD may be efficacious for sleep problems. So again, when people say to me there's no evidence for cannabis for doing this, that and the other, it's usually they haven't read it. And I'm talking about a lot of my medical colleagues here. Not the ones in the room, but other people. Now, this was a systematic review. Again, they pull 11 different studies. So this is about 203 participants' data, and they looked at recreational cannabis on sleep. Now, in 5 studies, actually used subjective measures of sleep, and in 3 of those out of the 5, they found cannabis was found to decrease the time it took to fall asleep, sleep latency. In one of the studies, it had no effect, and the other one, it didn't measure it. And the other thing is that out of those studies, no study actually showed any effect on the number of times people woke up during the night. That was actually assessed out of 4 studies. So there's some data here that suggests that cannabis might be useful, but there are other studies in the literature that show that cannabis could be associated with causing sleep problems, or being associated with it at least. So we've got to be a little bit careful in sort of saying that, yes, it's great for everything, because it's not. The literature doesn't support that at the moment. But it's another area where I'd have to say we need more research in this area. And these are studies that are not specifically in cancer population either. This is just in general population. Now, where we do have pretty strong evidence is the use of cannabis in chemo-induced nausea and vomiting. So that book on the right-hand side was published in 2017, and they only used data from these gold standard randomised controlled trials and systematic reviews, which are what we pull those randomised controlled trials. So they only used that as evidence. And they said, based on this, there is conclusive or substantial evidence that oral cannabinoids are effective antiemetics, so stop vomiting, in the treatment of chemo-induced nausea and vomiting. So that's their gold standard, and I think that's pretty convincing. They've done some animal models here, and they've found that the acid form, CBD acid, is 1,000 times stronger than CBD in decreasing acute and anticipatory nausea. And that's often a problem, is that you sort of get in your mind an association between feeling sick and having chemo, and guess what? Next time you go to have chemo, you're going to feel sick. Anticipatory nausea is difficult. They did a rat study, and they actually found that low doses of CBD acid potentiated the anti-nausea effects of a common drug used for nausea, ondansetron. So again, this is promising research here. So when you get the plant and you get it out of the ground in your backyard, it's got the acid forms of the cannabinoids, THC acid, CBD acid. It's only with heat and light and aging that what they call decarboxylate those, and it changes into THC and CBD. Now, there's not much in the literature on oral mucositis, and this, I think, is a real area that's ripe for research, but they set up a mice model of it instead. And they actually found that CBD was able to reduce the inflammation and severity of these oral lesions and help the tissue repair. Finally, cachexia, there's a few studies here. They did, and these are obviously in cancer patients. So THC was found to significantly, that means statistically it was shown to be significant. And that's what we hang our hat on in science. It has to be statistically significant. So it was shown to be to improve pre-meal appetite and the percentage of calories consumed as processed proteins compared to placebo. There was another study in 17 patients, and they found a weight increase of more than 10% in 3 out of those 17 patients. And finally, a systematic review pooling 3 studies found that cannabinoids were able to increase appetite, but there was some suggestion of a decreased quality of life, and that's possibly due to, some of the side effects that you can get as well. Now, cancer-related pain, again, there is evidence in the literature. This study did a comparison of a THC dominant, a CBD dominant, and a mixed THC-CBD, and over 1 month, they found that there was significant improvement from baseline, including the pain intensity and sensory pain, improvement in sleep quality and duration of sleep, improvement in terms of cancer distress and physical symptom burden and psychological symptom burden. And in general, there wasn't much difference between those 3 different types of cannabis medicines, so that was very interesting. This one was in nabiximols or Sativex, that 1-to-1 ratio of CBD to THC. This was a placebo-controlled double-blind, so the patients didn't know what they were taking, the doctors doing the measurement didn't know what group the patients were in. So this is the gold standard in terms of setting up a study. 263 people with advanced cancer and opioid refractory pain, which means they weren't responding to opioids. Now, they either got put into the low-dose nabiximols group, a medium dose or a high-dose nabiximols group, or placebo. Now, at 5 weeks follow-up, in the low and medium-dose nabiximols group, it was significantly more effective in reducing their average daily pain compared to placebo. And it was only in the high nabiximols group that actually compared unfavourably to the placebo group in terms of adverse events. Now, the last study I want to talk to you about is in terms of palliative care. This study was done in Israel between 2015 and 2017. This is nearly 3,000 patients with cancer, mean age around 60 years. And the main symptoms they were using it for were sleep problems, pain, nausea, and lack of appetite. Now, at 6 months follow-up, about a quarter of the patients had unfortunately died, and nearly 20% had stopped treatment. But of the remaining, 60% responded to the survey. And of this group, 96% reported improvements in their medical condition. And only 3.7% said I didn't get any change, and only 0.3% said that they got a deterioration. The symptoms most improved were the nausea and vomiting, sleep, restlessness, depression, itching, that's pruritus, and headaches. And they also found that over a third reported a decrease in their regular medication consumption. Now, they did have some side effects reported, at least one side effect at 6 months follow-up by nearly 30% of the patients. The most common was dizziness, dry mouth, sleepiness, and some psychoactive effects. So this group of researchers in Israel concluded cannabis is use in palliative care is well tolerated, effective and safe. Now, CBD cannabidiol has been found to be able to synergise with various chemotherapeutic agents to increase their ability or their effectiveness. So in cell studies, they've found that CBD is able to sensitise cancer cells to cisplatin and significantly increase cisplatin-mediated programmed cell death, apoptosis. So again, we see this potential to use them together in a good way. Another study in cells found that CBD and THC together combined with anti-leukemia drugs, and they sensitised the leukemia cells to the cytotoxic or cancer-killing effects of the drugs. And that meant it allowed the doses of these other drugs to be lower. And that's a good thing, because a lot of these drugs have actually got nasty side effects too. Now, it's not always, not everything is positive. So some studies do suggest some caution in relation to cannabis and some of the immunotherapy drugs. Cannabis does have side effects. It may be contraindicated in some patients. There is potential for CBD, THC and some of the other phytocannabinoids to adversely interact with some drugs. And that's because they share common enzymes that break them down. So I think the take-home message here is that really, in terms of medicinal cannabis use for any condition, not just cancer, but any condition, it's always good to consult a healthcare practitioner who is well trained in medicinal cannabis. So just to conclude, I think we can say, look, there's a reasonable amount of preclinical, that's before it comes into humans, evidence that constituents of cannabis may be able to address many of the pathways involved in cannabis, as well as what we call the hallmarks, the features of them. I think we can say comparatively, there's little clinical evidence in terms of randomised controlled trials. Mostly we have case studies. I think that there is evidence from preclinical animal studies and human research that medicinal cannabis might be able to help with some of the signs and symptoms associated with cancer, as well as its orthodox treatment. But I think it's also very fair to say that more studies are required within patients with cancer, because we're drawing on evidence from other conditions and sort of saying, well, it probably should, logically apply to cancer as well, like anxiety, for example, or depression. Now, there is evidence that poor diet, stress, deficient vitamin D, poor sleep, lack of exercise or a sedentary lifestyle, all of these can actually contribute to cancer, as well as environmental factors and genetic and epigenetic factors. So we have to be very careful. As I said, in looking at cancer, there's many, many factors that I think are involved here. So in any treatment of a disease, not just cancer, but cancer as well, we need to look at what is the underlying causes of dis-ease. So again, we come back to this idea of an integrative medicine approach, which combines the best of orthodox medicine, as well as lifestyle changes, nutritional medicine approaches, complementary medicines like supplements, herbal medicines, acupuncture, things like that. And these can help address what I call the pillars of health. We want to minimise stress. We want to have good diet. We want adequate vitamin D. We're outdoor plants, as one of my colleagues used to say, so we need to get out in the sun and get our vitamin D. We need to have good sleep, very, very important. We need to exercise. There is plenty of evidence in the literature that these can all help contribute to better outcomes. And as Professor Avni Saleh, who was my mentor many years ago, sort of said, a healthy patient with cancer will do better than an unhealthy one. So we want to do as many approaches to be healthy. So I see medicinal cannabis really as just one part of an integrative approach to the treatment of cancer that includes, as I said, the treatment of the signs and symptoms that can be associated with cancer, as well as its orthodox treatment. And look, if anyone says there's no evidence, I've written 2 books. 2017, I wrote A Clinician's Guide to Integrative Oncology, and that's all about those pillars of health, to put the evidence there to medical colleagues that, hey, there is evidence, and this is what you should be talking about, and this is why. The other one was published last year. It was Medicinal Cannabis and CBD in Mental Health Care, because again, I got sick of people saying there's no evidence for, da-da-da. So I wrote a book on it to actually compile, at the time, the state of play in terms of evidence in mental health. So that's it for my talk today. I hope that's been useful. I hope it hasn't gone too much over your head, because I actually wanted to bring home, I guess, some important messages here that in science we try to understand what's going on. This is a biomedical approach to understanding how the human works. Now, of course, I'm schooled in Chinese medicine, so I've actually got my own ideas of how the human body, mind works. And it's not framed in terms of chemical messengers and nuts and bolts that we tend to use in the biomedical paradigm of understanding how we work. I think of things more on an energetic level as well, and there's many other traditional medicine systems that actually look at that too. But even if you just looked at good old physics, we are vibrating molecules, aren't we? And mostly everything that we look at and think is solid is made up of space, including us. So I always come back to sort of the point that we have the power within ourselves to self-heal. That's why, we have such an amazing system in our body. You need to learn to tap into that in so many different ways. Find practitioners, find your own way of moving through this with any kind of illness, not just cancer. But there are many people around that can help you, and there are many different paths. But just come back. This is your most powerful thing, your mind. And so I think that it is within us. When we do get out of balance, because that's all disease is in Chinese medicine, we've got out of balance, dis-ease, to bring yourself back into balance. And you do have the ability to do that, I believe. So, thanks very much for listening.
Thank you so much, Kylie.